Well, in today's Baby Talk segment, we are talking to pediatrician Dr. Bobbie Colbert. Thank you so much for joining us.
Not a problem.
Absolutely. Now, you said that you've been seeing a lot of patients come in with diarrhea, throwing up. What exactly is that?
Well, we're seeing lots of, this is the season for viruses, and especially intestinal viruses. And we're seeing lots of children and their parents getting rotavirus infections, this is the time of the year we generally see them when people are in the same space at the same time for long periods of time. Also, it's viruses like the norovirus that we're seeing on a lot of the cruise ships that a lot of the people are getting. The rotavirus, which is more prevalent in children and that we're seeing now, is primarily spread by hand-to-mouth contact. The norovirus that you're seeing on a lot of the cruise ships are spread also by airborne spread. So it's not just hand-to-mouth, it's airborne spread in that particular virus. But what we're seeing right now in the community is primarily the rotavirus infections.
Okay, so what can parents do to help their kids with this type of issue, this type of virus?
Well, the main thing is to avoid contact. And the best way to do that is make sure you have good hand washing techniques after going to the restroom. Make sure you wash your hands thoroughly. Make sure that when you handle someone or a child who has a viral infection that you wash your hands and you avoid spreading it to the rest of the family members that way. Also, in terms of treatment, primarily you want to give the intestinal tract a rest, the stomach a rest, by putting them on clear liquids and liquid diet initially until the virus runs its course. It generally runs its course in about 3 to 5 days.
Do you suggest that they do bring their child to their pediatrician, though?
If the child has signs that he's getting dehydrated, and that is he's not making urine, he's not making tears, signs that he may be dehydrating, they need to contact their pediatrician.
Okay, but basically a virus, you just need to naturally take its course.
Yes, it's going to run its course no matter what you do. You want to keep the child hydrated, and that's the mainstay of treatment.
All right. Well, Dr. Colbert, as always, thank you so much for your expertise. Something to look out for. So just keep the child hydrated and take away those solids.
Take away those concentrated foods.
All right. Thanks so much. We're going to toss over to Dana for a final check of the weather.